Okay, so this is DDC-2 on the interlock, and the controls are basically identical in function to the outer lock. There's a couple of other things, and we're going to point those out. Your oxygen system is located right up here. The gas comes in again through an operator-controlled hull stop on the outside. It's a green valve. It's a slow opening valve. Comes into a bar stock valve, another slow opening valve. So I would open this counterclockwise 2 or 3 turns. That is going to give me oxygen supply to the masks. Now I have 2 masks in the interlock as well. So I'll screw this in until I get free flow and then back out until it stops. Hold the mask up to my face. Exhale. And it is not discharging because of the back pressure, but the gas when I exhale comes right through here and comes up into a manifold. The other mask comes in here. Now this manifold is unique because there's a new device here, a new component, which we do not have in the outer locks of most chambers. This is a back pressure regulator. It's a Tescom back pressure regulator, and it is used to prevent the hoses from collapsing at depth. And it makes it much easier to exhale through the masks with this back pressure regulator and maintains a constant pressure in the hose. So the gas will come through this regulator and then will come out through this overboard dump valve, which must be open. So this valve is in the normally open position when we're breathing oxygen. Now if you follow along here, you'll see that there is another bypass valve right here. This is a new component. In the unlikely event that this regulator were to fail or be stuck and you could not exhale, you would open this valve and that would bypass this regulator. So gas would come through here, down through the valve, through the overboard dump, and then outside the chamber. So that's the purpose of the bypass valve, normally left in the closed position. Okay, you saw there were quick disconnects for the bib masks. As far as controls on the inside, these 2 valves right here are the inside controls that are not normally used. This is the gas supply. That would pressurize the chamber if the operator opened this on the inside. We do not normally operate that way in a commercial environment. This would be the exhaust valve. So conceivably the diver could ventilate himself by watching the caisson gauge here and staying at a constant depth. But normally we will not use those. You probably are not going to see those in a commercial environment. Now, normal controls that you will see in normal operation is this valve right here. This is the supply valve for the gas coming in. So when the operator pressurizes the chamber, Damon, are you still on the comms out there?
Topside, loud and clear.
Okay, so why don't you go ahead and give me a blast of air to the interlock air supply. Interlock air supply.
Roger.
Just a blast. Interlock. There it is. Okay, thank you. Now, the exhaust for that is located right over here. You're getting a little bit more separation here between the supply and the exhaust. So when the chamber is ventilated, the gas moves from here to here. So you're getting about that much area in the ventilation process here. Okay, so those are your inside controls. This device right here is a sound-powered phone. This guy here, we would press the talk right here and we could talk to topside. In the event of a communications failure, typically you can shout on the outside of a chamber, or you can even put a note up to the viewport. Doesn't necessarily constitute an emergency when you lose communications in a hyperbaric chamber. Depends if you're in a hospital or a commercial environment. Up with the rest of the controls here. This valve right here, this is taped in the open position. This is the shutoff valve for the sample gas port on the outside. This samples the air environment from the chamber. This is normally left in the open position. This device right here is an open valve that supplies for the gag valve, the pressure relief valve on the outside. This is normally left in the open position. And then of course your your exhaust valve right here. So you're getting, like I said earlier, a lot more exhaust, or a little bit more circulation here than in the interlock. Okay, so we've got sound powered phone, sample gas shut off, relief valve shut off. These are normally left in the open position. They're tie wrapped and taped in the open position. All right, last things on the inside, we want to go through safety gear. This, of course, is a urine bottle for collecting urine during treatments. It's graduated with marks so we can tell how much urine a diver is passing. Then we have a fire extinguisher right here. This is nothing more than pressurized water. So this device here, we would lift off the bracket, pull the pin here, squeeze the handle, and then point this nozzle towards the base of the flame. In the unlikely event of a fire, it's just pressurized water again. We need to periodically check and make sure that this has enough pressure in it. Usually about 90 psi or so suffices for what we're doing. This is an emergency fire blanket. It opens at the bottom right here with Velcro, and pull this out. In the event of a fire, you could use this to cover up or to smother the fire, but it gives you a fighting chance. Fire in a hyperbaric environment is not a good thing. Spreads very quickly, but it's one reason we want to sample our oxygen, keep our oxygen content less than 23% by volume. We've got a little blanket in here, cotton blanket for just for comfort, for diver comfort. But that is pretty much it as far as the devices inside the chamber. And we've got our caisson gauge. This is a video camera that's plumbed up to the outside so that we can see what the occupants are doing.